The world of work is changing rapidly, and in this podcast, we're examining the challenges and possibilities emerging within this change. We're talking about everything from labor market information to how to enable the thinking and doing that leads to better workforce development and employment outcomes. This is the Workforce Collective podcast. Hey everyone, and welcome back to the Workforce Collective podcast. I'm your host, Caleb Meeks, marketing assistant and content creator for Workforce Collective. And today I'm joined by Thalia Semplonius, research and project lead for Workforce Collective. We'll be discussing our most recent brief about the healthcare sector titled Trends in Healthcare Workforce Sustainability. So Thalia, thank you for being here today to chat with us.
Thanks for having me on the show, Caleb.
My pleasure. So let's get right into it then. First question, when we think of the healthcare sector, we think of doctors, nurses, your typical medical staff. But would you be able to tell me what the healthcare sector is comprised of? Like, what are some of the most common jobs and what are some that people wouldn't even think of?
So this is an interesting question because it gets at the way we actually source data. So if you'll allow me a minute to enthuse about some research methods, in the brief, readers might notice that we refer to healthcare and social assistance at the beginning. This is because the industry-specific data we have access to is coded in a specific method, which is called NAICS, or North American Industry Classification Systems, which groups these two sectors together. So this means when we look at jobs in the industry, we also see workers like nurses, aides, orderlies, and patient service associates, registered nurses. We also see jobs like social and community service workers, early childhood educators and assistants, receptionists, and other jobs. However, since this is a healthcare-specific brief, in much of this we focus on healthcare-specific insights. So the jobs we refer to most then would be jobs like nurses, aides, and orderlies, registered nurses, registered psychiatric nurses, licensed practical nurses, doctors, those types of jobs. But all that to say, there's a large realm of jobs that fall into the industry.
Yeah, that's really interesting. ECEs, like early childhood educators and assistants, that's a part of healthcare?
Yep, falls within the industry. So another methods type thing. So you can have ECEs that work within the healthcare and social assistance industry. They might also be working in the education industry too. So you can have similar types of roles across different sectors. So the work they do may differ slightly depending which industry they're actually working in. But yeah. This is why we see jobs across different areas all the time.
I wonder if other people knew about that, because when I think of ECEs, like the sector that they would belong to would be education rather than healthcare. So that was interesting.
Cool.
So our workforce all around seems to be facing challenges attracting and retaining talent amongst a list of other things. What are some of the challenges the healthcare sector is facing that we found in our research, and what might be causing this?
So through the pandemic, we know that individuals working in healthcare experienced even higher levels of stress, burnout, and an increase in people actually needing their services alongside staffing shortages. So this obviously impacts the capacity of people working in healthcare. Some research we found by the Conference Board of Canada in late 2021 showed that in addition to understaffing being a big challenge, about 57% of respondents to their survey had actually considered leaving their job in the past year. So given the increased workload, obviously burnout and mental health are key concerns for people working in these healthcare jobs.
So I heard you say stress and burnout and understaffing. That seems like a common issue within a lot of sectors, not just healthcare.
For sure. And I know in other podcasts we've recorded together and other ones in, the Workforce Collective series, this has been a topic that's come up multiple times. So not necessarily healthcare specific, but we know that these workers did experience this maybe on an even higher level.
So I'm sure I can't be the only one who's gone into the hospital and you've had to wait hours, like 8 or 9 hours even, for a doctor, or had their family doctor schedule them for an appointment nearly like a half a year away. Maybe that might be an exaggeration, but literally months away. Or maybe you know someone who doesn't even have a doctor at all. Is this a result of the challenges the sector is facing?
Right. So based on what we've read, finding family doctors is not necessarily a new challenge, but the problem or challenge has increased since 2019. So right now, there's more than 1 in 5 Canadians without a family doctor. And in Ontario, about 3% of family doctors stopped working in the first 6 months of the pandemic, which is double the number that we'd seen in prior years. Locally, an article from Niagara Health this past summer indicated that about 125,000 people in Niagara don't have a primary care provider either. So we're seeing this challenge locally, but provincially and nationally too.
125,000 people in Niagara alone.
Mhm.
That is a lot of people. And I hear often when we're talking about shortages or things that the sector's struggling with, like the workers are struggling with, in those same conversations, you'll hear the pandemic come up a lot. It seems like it really took a toll on not just the workers, but the people that need the services. Seems to have really changed a lot.
For sure. And I mentioned that mental health and burnout was a challenge for workers. We know that across the pandemic, for the population in general, these challenges increased too.
Oh, I can imagine with the conditions that people were living in when everybody was locked down
Mhm.
and with a increased demand and people leaving their jobs out of things like fear or whatever the case may be, it's a lot for a person to take on.
For sure.
So how can the sector recover from these challenges? Like, what are some possible solutions that could be addressed to assist workers in healthcare and filling labor shortages?
So I'll go back to the survey the Conference Board of Canada did. The respondents to their survey proposed a few actions. Their suggestions were restructuring the healthcare workforce or maybe delivery models, investing in public healthcare infrastructure, and then recruitment initiatives for healthcare staff. Given some of the research we've engaged in, clearly, given that a lot of the challenges are tied to understaffing and staffing challenges too, we need to look at ways to support recruitment into the sector. We also know that there's many trained health professionals that can help support the system, but are dealing with barriers to entry for employment in the field. So, for example, many newcomers to Canada are internationally educated healthcare professionals who experience challenges when seeking employment, including navigating a complex immigration system, expensive processes and exams that have to be completed alongside other challenges like hiring bias and discrimination too. So this is a demographic that could help, particularly as we know in 2022, about 20,000 internationally educated nurses and thousands of international medical graduates were not working in their field in Ontario. So IEHPs are critical to the healthcare system. Their contributions are key to addressing healthcare needs. They have expertise, can provide culturally sensitive care, diverse language skills to an increasingly diverse population here, in addition to filling available healthcare jobs that we know are around.
Yeah, 20,000 vacancies, that could really help a lot. You know, we've talked about it in previous podcasts before, the barriers that IEHPs face. And it seems like there may be work being done, but you would think that you would just want to be able to open up some of these vacancies and help some of these people. Like 125,000 people in Niagara is a lot.
Mm-hmm.
So if we're going to address this, like what needs to be done to see these changes possible?
So some programs are already trying to address shortages in the healthcare system. A local one was the Niagara Folk Art Multicultural Center's Healthcare Navigator training program for IEHPs. So they actually delivered a 13-week program on communication skills, required ethics, and a health system overview to IEHPs. They then had the opportunity to engage in a co-op program to address challenges they had entering employment in the field. So locally, we've seen that work occurring. More widespread, there's bridging programs and training resources too. These programs work with IEHPs to ensure they can obtain non-medical skills required to find healthcare-related work. These programs may also teach about the Canadian healthcare system and potential career paths. And then we recently saw World Education Services list of initiatives across Canada that are supporting IEHPs. They delineate this by province, but overall they indicate that the themes of this ongoing work are really focused on reducing entry barriers for IEHPs, system navigation programs, financial aid, and then expanding programs and assessments and updating regulation and legislation. So I guess some of the changes are locally targeted for local needs, but also more widespread on, what policies might have to change, what's going on at the system level that we need to work with.
Well, that's great that things are being addressed. You can hear throughout this podcast, you can hear us talk about the burnout levels. And this probably makes sense to a lot of people listening that wonder, why am I in the hospital? Why am I waiting so long? Why are things taking forever? It seems like the sector needs help. So
For sure. And I think it's good for people to have an understanding of where the situation different industries are in too, right?
yeah, I mean, otherwise you're just like confused and frustrated at the same time. And the two of those don't go well together when you need help.
Yes.
Well, Thalia, that's all of our time for today. So thanks so much for sharing all your amazing insight.
Thanks for the chat, Caleb.
Of course. And thank you everyone listening. If you want to learn more about our work surrounding the healthcare sector, Visit our website at workforcecollective.ca and click on Featured Publications under the Tools and Resources tab. And we invite you to follow us along our journey through LinkedIn, Twitter, and our monthly newsletter. And stay tuned for more episodes of the Workforce Collective podcast. You can find us on YouTube, on Spotify, or just say, Alexa, play the Workforce Collective podcast. Thank you for being here.